There are two types of stroke. There's ischemic stroke and hemorrhagic stroke. Ischemic stroke accounts for about 87% of strokes that we see within the hospital. An ischemic stroke is when there's a blood clot in the vessel of the brain that blocks the oxygen from getting to the brain, and it causes brain cell ischemia and death. A hemorrhagic stroke is when there's a bleed in the brain that also causes brain cell death. It's important for people to know the symptoms of stroke because they need to seek treatment as fast as they can. In order for us to be able to treat people with stroke, we need to see them right away. There is a drug that can be used, the clot-busting drug TPA, but we need to see someone within the time frame of about 3 to 4.5 hours to be able to use that drug. We use the word fast to help people identify the signs and symptoms of a stroke. F is for facial droop or facial numbness. So if you notice that someone's face is drooping on one side, you can have them smile, and if their smile's uneven on one side or the other, then they could be having a stroke. A stands for arm weakness or arm numbness. You can have somebody hold their arms up out in front of them. If one arm starts to drift down, then they could be having a stroke. S is for speech disturbance. So is somebody having slurred speech, or are they saying something out of the ordinary? You can have them repeat the sentence, "The sky is blue." And if their speech isn't normal or slurred, then they could be having a stroke. T stands for time to call 911. If anybody has any of these signs or symptoms, then you need to call 911 as soon as possible. It's important to get to the hospital quickly because time is brain. About 1.9 million brain cells die per minute when the brain's deprived of oxygen when having an ischemic stroke. And there's things that we can do to help with that within the hospital, but we need to see our patients as soon as possible when the symptoms begin. We have the drug TPA, the clot-busting drug, that can be given out to 3 to 4.5 hours of onset of symptoms. After that time frame, the drug doesn't work. So as soon as if we see a patient right away when having these signs or symptoms, we can work them up quickly within the hospital and get that drug in as fast as we can. If you suspect that somebody's having a stroke, you need to call 911 immediately.